Welcome back to the channel. We are diving straight into the headlines with Mark Cuban's blunt response to the healthcare affordability crisis. Cuban dropped a bombshell on social media, claiming that every single family in the USA is paying an astonishing $800 a year to big insurance companies. This isn't just talk. He's pointing directly at the growing costs of Medicare Advantage and the massive financial burden this places on taxpayers. We break down what this means for seniors and how the market structure is fueling these soaring healthcare prices.
Never get caught with a dead phone again. This INIU portable charger is compact, travel-friendly, and gives you fast 45-watt charging with a built-in USB-C cable, so there's no need to carry extra cords. With 10,000 mAh power, it's perfect for busy days, trips, emergencies, or anytime your battery drops too low. Grab yours on Amazon through the link in the comments before your phone hits 1%.
Next up, we look at the deep dive into the Medicare Advantage landscape. We examine the specifics of these private plans, how they differ from traditional Medicare, and the alarming projections from policy experts. We explore the data showing that Medicare Advantage costs are significantly higher, and we uncover the complex web of ownership involving insurers and pharmacy benefit managers that Cuban calls the Darth Vader of the pharmaceutical industry. Now, shifting gears to education and debt, we hear Mark Cuban lay down his firm's stance on student loans. He calls taking out a loan for college the dumbest thing you can do, and presents a revolutionary two-step alternative. Learn the exact strategy he recommends, starting at a community college, and discover the hard data showing how this path can save students tens of thousands of dollars and help them escape the crippling debt trap. And finally, we pivot to the world of business success with a massive expansion from the Shark Tank. We follow the journey of Collars and Co. as they announce the opening of their first permanent Virginia store at Reston Town Center. This move solidifies the brand's national presence, and we look at how Mark Cuban's initial endorsement helped propel this menswear brand from a pitch to a multi-location powerhouse. Stay with us, because we have more breaking news coming up. Mark Cuban has reignited a national conversation about the escalating cost of U.S. healthcare, issuing a blunt critique regarding the affordability crisis, particularly focusing on Medicare Advantage plans. Cuban posted on X claiming that every family in the United States is reportedly paying $800 annually to major insurance companies, attributing this burden largely to the rising costs associated with Medicare Advantage, which was initially promoted as a more efficient alternative to traditional Medicare. Medicare Advantage plans function as private healthcare options where insurers bundle Medicare Parts A and B and add supplementary services like dental or vision coverage, often including patient spending caps. However, these plans impose network restrictions on doctors that are not present under traditional Medicare. Policy experts indicate that Medicare Advantage plans are projected to cost 14% more than traditional Medicare plans in 2026, representing a potential difference of approximately $76 billion, which aligns with Cuban's estimate of an $800 per family tax burden. Furthermore, a bipartisan Joint Economic Committee report revealed that Medicare Advantage overpayments have already increased Medicare Part B premiums by about $212 per enrollee in 2025, signaling that the trend is not improving. Cuban argues that the high cost of U.S. healthcare stems not just from waste or fraud, but from a market structure that favors large health conglomerates. He contends that these insurers have amassed fortunes by controlling multiple points in the patient journey, including physician groups, management service organizations, pharmacy benefit managers, PBMs, and even some pharmacies. This consolidation allows companies to set prices for care and coverage simultaneously, incentivizing profit over affordability. He specifically targets PBMs, labeling them the Darth Vader of the pharmaceutical industry for allegedly operating in the shadows, capturing significant rebates, and failing to share savings with consumers. This critique mirrors concerns raised by lawmakers, including Senators Elizabeth Warren and Josh Hawley, who have proposed the Break Up Big Medicine Act. This proposed legislation aims to prevent a single parent company from owning both a health insurer and a PBM or physician provider group, requiring them to choose one side of the transaction and introducing oversight by the FTC and DOJ. In an effort to address drug pricing transparency, Cuban has launched his Cost Plus Drugs program, which offers consumers transparent online pricing for generic drugs based on acquisition cost plus a fixed markup, allowing patients to see ingredient costs. Independent analyses suggest that generic medications can be significantly cheaper through this model compared to insured copays. Despite systemic efforts to reform the system, the financial uncertainty remains for seniors. With Medicare Advantage enrollment at record levels and premiums rising, unpredictable budget expenses can jeopardize even robust retirement plans. Financial advisors suggest that individuals should proactively review their Medicare plans annually to compare out-of-pocket limits and drug formularies, taking necessary adjustments to ensure they are securing the promised savings. Mark Cuban has ignited a firestorm regarding the escalating cost of healthcare in the United States, posting on X that every family in the U.S. is reportedly paying $800 annually to major insurance companies. Cuban is specifically targeting the rising expenses associated with Medicare Advantage plans, which have been criticized for shifting costs onto taxpayers. Medicare Advantage plans, which bundle Medicare Parts A and B with supplemental coverage, operate differently than traditional Medicare, imposing additional network restrictions on enrollees. Policy experts estimate that Medicare Advantage could cost 14% more than traditional Medicare in 2026, equating to a projected $76 billion difference, or the $800 per family burden Cuban cites. This concern is amplified by data showing that Medicare Advantage overpayments have already increased Medicare Part B premiums by approximately $212 per enrollee in 2025, indicating a worsening trend. Cuban attributes the high cost of U.S. healthcare not solely to waste, but to a market structure that favors large health conglomerates. He argues that these companies control numerous aspects of the patient journey, including physician groups, management organizations, and pharmacy benefit managers, PBMs. By controlling pricing across coverage, care, and pharmaceuticals, these entities are positioned to prioritize profit over affordability. He has specifically labeled PBMs as the Darth Vader of the pharmaceutical industry, claiming they operate in the shadows, capturing significant rebates without incentivizing customer savings. This viewpoint aligns with concerns voiced by politicians, including Senators Elizabeth Warren and Josh Hawley, who have advocated for legislation like the proposed Break Up Big Medicine Act. This proposed bill seeks to prevent single-parent companies from owning both health insurers and PBMs or physician groups, mirroring the Glass-Steagall Act to ensure competition and prevent price manipulation across the supply chain. In response to these systemic issues, Cuban has also pursued solutions, notably through his Cost Plus Drugs program. This initiative offers transparent online pricing for generic drugs based on acquisition cost plus a fixed markup, allowing consumers to see exactly where their money is allocated. Independent analyses suggest that generic medications sourced through such models can be significantly cheaper than insured copays, pointing to a potential avenue for reducing medication costs. As Medicare Advantage enrollment hits record levels while premiums continue to rise, the financial uncertainty remains high for seniors. Experts advise consumers to proactively review their Medicare Advantage or traditional Medicare plans annually, comparing out-of-pocket limits and drug formularies to ensure they are securing the savings they expect. The ongoing debate highlights a critical juncture where structural reform and individual consumer action are both necessary to tackle the complex affordability crisis. Billionaire investor and former Shark Tank star Mark Cuban has issued a stark warning against taking out student loans for college, labeling it the dumbest thing you can do. In a recent appearance on the Impulsive podcast, Cuban proposed a two-step alternative that he argues offers significantly better financial sense. His prescription is to begin education at a community college and then transfer to a 4-year university later, arguing that foundational coursework is largely transferable across institutions. Cuban contends that the academic content at affordable community colleges is comparable to that at elite institutions, suggesting the cost disparity between a top-tier school and a solid public university is often not worth the resulting debt burden for most students. Data supports this argument. The College Board's 2025 Trends in College Pricing report indicates that average tuition at public 2-year community colleges is substantially lower than at public 4-year institutions or private nonprofit schools. The financial urgency is underscored by broader economic data. Federal Reserve findings show the median outstanding student loan balance sits between $20,000 and $24,999, with the average federal student loan balance per borrower exceeding $39,000 last year. Furthermore, student loans are notoriously difficult to discharge, including in bankruptcy, a factor Cuban cited as a major contributor to rising college costs. Cuban also pointed to a concerning trend, noting that the total number of degree-granting post-secondary institutions in the U.S. has slightly declined between 2022-23 and 2023-24, a trend he predicts will accelerate. He believes that by prioritizing affordable starting points, students can avoid the debt trap. When examining the data on educational debt, Federal Reserve analysis revealed that only 44% of borrowers carrying student loan debt reported that the financial benefits of their education outweighed the costs, compared to 68% among those who graduated debt-free. This disparity highlights the financial risk associated with student borrowing. Cuban's core advice is to prioritize affordability. The first question for any student should be which school they can realistically afford to complete. By starting at a community college and transferring strategically, students can potentially save tens of thousands of dollars before incurring significant debt, suggesting a more lucrative path than traditional loan-based financing. Montgomery County-based menswear brand Collars & Co. is accelerating its national expansion following a significant deal on Shark Tank with Mark Cuban and Peter Jones. The company is set to open its first permanent retail location in Virginia, establishing a new footprint in the growing apparel market. The new 1,700-square-foot store will open in late May at 11,869 Market Street in Reston Town Center. This move marks a major milestone for the brand, which has cultivated a dedicated customer base centered around its signature dress collar polo. This innovative garment features a patent-pending design that successfully merges the comfort of a polo shirt with the structure of a dress shirt, creating a versatile modern business casual aesthetic that propelled Collars & Co. into national consciousness. During their television appearance, Mark Cuban hailed the product as a game-changer, which was instrumental in introducing the brand to a broader consumer base. Since that moment, Collars & Co. has successfully expanded its reach far beyond the Washington, D.C. area, attracting a diverse clientele including athletes, executives, and celebrities seeking apparel that balances comfort with polish. The Reston location bolsters the company's growing retail presence. Collars & Co. currently operates stores in Rockville, New York City, Boca Raton, Chicago, King of Prussia, and Dallas, with its Rockville storefront maintaining its status as the Maryland flagship. The new Reston Town Center store is designed to offer an immersive shopping experience, integrating high fashion with sophisticated interior design. Operational hours for the new location are anticipated to be Monday through Saturday, 10 a.m. to 7 p.m., and Sunday, 11 a.m. to 6 p.m.